My name is Ashish Patel. I'm an oral maxillofacial and head and neck surgeon. One of the things that's really attracted me to this particular field of medicine and surgery is the ability to have really a profound impact on somebody's life. We look at somebody, we immediately recognize them by their face, their teeth, their smile. And that really, I think, is an integral part of what defines somebody's individuality. I always feel privileged to be able to help people through difficult problems in that region. My father was a mechanical engineer, and he spent his whole life building parts for airplane engines, and during the summers I always worked for him in his machine shop, learning to build titanium parts for turbines and engines. And I really liked the intricacy of something so complex and small, but when put together, runs seamlessly. Surgery for me was the combination of all the things I love most about the complexities and intricacies of the human body and the art and science of engineering. I think as surgeons, we follow the science of medicine and surgery, understand disease processes and treatments and outcomes based on experience and data. But I think one thing that is always difficult to do is to understand what a patient might be going through, because although we see this every day, we don't necessarily experience it from the patient's end. So I try to always put myself in the patient's shoes and do the best I can to understand their perspective and point of view. I want my patients to feel comfortable, to feel at ease, and when they're at their most vulnerable, feel that they're going to be taken care of and get taken care of. One of the biggest things in our field of oral maxillofacial surgery has been the advent of computer-aided design and manufacturing and patient-specific solutions. We're able to plan our treatment prior to even getting the patient on the operating table, and it allows us to really precisely predict what our outcomes will be. So somebody can walk in with a significant problem, whether it's a severe infection of their jaws or a tumor of the jaws, and leave surgery with not only that removed and cured, totally reconstructed, including bones, soft tissue, and teeth. And one of the most gratifying things is somebody waking up from surgery and looking essentially like they looked and feeling essentially like they felt before their procedure, now without the disease process that's impacting their quality of life. My why every morning, why I wake up to do it, is the significant impact I have on somebody's life when I'm treating them, and the satisfaction I get out of being kind of their person is really important to me. And the surgery and the mechanics of it is still very interesting to me, but the more nuanced part is the human interaction, and that's the part I enjoy the most.